Nestled in the Himalayas, the Kargil district, one of the two districts of Union Territory of Ladakh, India, is situated between 30 to 35 degree north latitude and 75 to 77 degree east-west longitude, and situated at a high altitude ranging from 8,000 to 23,000 feet above the sea level. To support national preparedness and response for COVID-19, which is causing global pandemic infectious disease, the district administration has set up its own isolation centre at Kurbathang, Kargil, situated near to Council Secretariat and Shiv Mandir at Kurbathang, Kargil. A separate entry point for COVID-19 patients is present at this dedicated isolation centre, so as to contain the infection and decrease its spread. The area of Kargil district is around 14,036 square kilometres, population 1,40,802, with villages 129 as per 2011 census. This dedicated isolation centre at GNM School Kurbathang, Kargil, now designated COVID-19 hospital, has separate entry for working staffs. In this two-way diversion, one way is paving various facilities required at this centre, and the other way is having separate entry point for staffs. The various facilities available in this ground floor on right side are having a laboratory equipment room. The interior glimpse shows such kind of view. Opposite to laboratory room is an ECG room, having this glimpse. Besides, there are duty staff's room for both male and female working in this setup. Also available in this side of the floor is a laundry room, to meet the requirement of cleanliness of this designated COVID-19 hospital, having this basic facilities within it. While on the other side of ground floor, where separate staff entry point is present, near to that, before the entry point, is the donning room, for putting on the protective gear, before entering the patient's area. After putting up the protective gear, if you check up near the entry point, present here is a room with a basic laboratory setup, and having a view inside looks like this. Present next to laboratory room is an X-ray room, with the X-ray machine, which is at most basic need. Moving further up this ground floor, you find a well-established clean ward, equipped with 8 beds for COVID-19 patients, which is neat and clean, and if the circumstances required, it can be converted to a full functional intensive care unit. For waste management, the color-coded waste bins are present near the door. If you enter further opening this glass door, you find a door for outside, which is the separate entry point for patients, we're shown before in this video. If you climb up the stairs of one floor, you come to notice of an entrance, from where the COVID-19 suspects and positive patients enter their respective wards. Near to the entrance are present, general observation ward on left side, and washroom for the patients besides the general observation ward. Present on the right side are 8 rooms for COVID-19 suspected isolated patients. You will find in this isolation ward a well-illuminated room from both natural light, well-furnitured, and the basic minimum requirement of an individual. You can see washroom facilities available here, are up to basic minimum required for these patients. You will find the color-coded waste bins all here and there. On moving in further, you can have view of outside from this area, and moving further you reach a room dedicated for intensive care unit. This room is equipped with 3 beds and is well equipped with ventilator, portable ventilators, cardiac monitors, oxygen cylinders. Also available for intensive care units is the area for the drugs and emergency kits, which are necessarily a prerequisite for intensive care units. Moving further you meet with another entrance point. Near to it is a 2-bedded intensive care unit rooms, with all facilities for invasive ventilation, for example ventilators, cardiac monitors, oxygen cylinders and others. This area from the near entrance is conserved for confirmed positive cases, and moving further and towards right side you will find 8 separate isolation wards. These isolation wards are having all basic facilities, and are well illuminated room from both natural light and electric lights, well furnitured, and the basic minimum requirement of an individual. And on left side besides the best washroom facilities, there is a separate ward area at a short distance, and on having a view you become comfortable to find in it well illuminated, well equipped and the potential to be able to convert in an intensive care units, should the situations demand in case. The total number of beds available in this ward are 5. After seeing all these, we are now at the exit gate for patients. Anyone who gets discharged are made to walk out through this gate, and anyone who has to come out from the above said wards are to come out through the exit gate shown here. Down the stairs there is an area to put off your donning clothes, after fumigation done to your covered body. All anti-infective and asepsis measures needs to be taken care, with full precautionary measures needed to counter an infectious diseases. The fumigation machine are present at the exit gate to fumigate anyone coming out of the patient wards, and there is a designated area known as fumigation area, which is near to exit gate. Some distance away is present a single-story building, where the kitchen facilities are available dedicated for this COVID-designated hospital. Thanks for watching. The accomplished design of this COVID-19 hospital would not be possible without the dedications of all administrative and executive heads, and the constant efforts of health warriors at this test of time. Thank you. Stay safe, stay at distance, protect yourself and protect the community.